De Quervain's tenosynovitis is the name given to pain from inflammation of the abductor pollicis longus and the extensor pollicis brevis tendons. De Quervain's classically presents with pain and tenderness along the thumb side of the wrist over here. And in this video, we're going to discuss how to diagnose it and, importantly, how to treat it with and without surgery. Now, the vast majority of cases don't require surgery. Hello, my name is Dr. Grant Cooper. I'm the co-founder and the co-director of Princeton Spine and Joint Center. De Quervain's tenosynovitis is generally diagnosed by history and physical examination, as opposed to, for example, an X-ray or even an MRI. Generally, patients will report that repetitive hand and wrist movements will exacerbate the pain. So, for example, gardening, playing golf, lifting a baby, forming a fist, turning your wrist repetitively, repetitively grabbing something like a hammer. All of these things will generally worsen the pain. Now, two groups of patients that I happen to see a lot with de Quervain's are young mothers because of all the picking up of their babies. And usually around springtime, we'll see a handful of new patients who have started working in their gardens after being relatively inactive during the winter, and they then develop de Quervain's from the repetitive use. The best three ways to confirm that you likely have or don't have de Quervain's tenosynovitis is one, the history of your pain, namely that you have pain in the classic location, and that the pain is worse with the kinds of activities that we already talked about. And the place where you get the pain should be tender when you push on it. And then there's something called Finkelstein's test, which is a really good physical examination test that doctors use to evaluate for de Quervain's. It's actually an easy test that you can do on yourself to confirm or refute the diagnosis. So basically what you do is you take your thumb and you bend it across the palm of your hand, and then you bend your fingers down over your thumb, and then you bend your wrist toward the little finger, and that maneuver should reproduce your symptoms if you have de Quervain's tenosynovitis. Of course, I want to give the necessary disclaimer that seeing your doctor is the best way to arrive at an accurate diagnosis, so please get checked out to be sure of what's going on. But as a general rule, these diagnostic points are very good rules of thumb. That was quasi-intentional. Importantly, de Quervain's should not be associated with numbness or tingling. If you have numbness or if you have tingling, there's likely something else going on, or maybe something additional going on in addition to de Quervain's, for example. So in any event, be sure to get your doctor to have a look at it if you're having numbness and tingling. So we said de Quervain's tenosynovitis is inflammation of the tendon. What are tendons? Well, tendons are rope-like structures that attach muscles to bone. Tendinitis is inflammation of one of those tendons. De Quervain's involves inflammation of two particularly vulnerable tendons that go to the thumb. So that's what de Quervain's tenosynovitis is. Now, how do we, and also how we diagnose it, how do we make it go away? That is, how do we treat de Quervain's tenosynovitis? Well, first you must know your enemy to defeat it. So what is this inflammation that we're fighting? Inflammation is actually a protein response in the body, but the best way for us to think about inflammation in this context of tendinitis is that it's like a fire. And when we think of treating tendinitis, there are two ways to put out that fire. One is to move away all of the sticks from around the fire and let the fire hopefully die out on its own. In a surgeon's world, that's going to mean surgery. And there is a surgical fix for de Quervain's, and we'll cover that in just a bit. But in over 18 years of practice, I've literally never had to send someone for surgery for a de Quervain's because non-surgical treatments generally work really well. So before we talk about surgery, and we will, let's cover the effective non-surgical treatments first. So first and foremost, in a non-surgical world, moving away the sticks from the fire of tendinitis generally means three things: exercise, relative rest, and or bracing. So let's talk exercises first. There's some basic stretching and strengthening exercises that can help strengthen the muscles and the tendons in the thumb and break up any adhesions that may have built up around the tendons. Importantly, don't exercise through pain for this problem. If an exercise is hurting you while you do it, or after you finish it, then pick a different exercise. Relative rest means to try to avoid the activity that's causing the pain. Sometimes this can be hard or impossible. A young mother isn't going to stop picking up her baby, for example. A plumber can't just stop using a wrench, etc. but you can try and limit the offending activity. You should also look at the activity and see if it can be modified or improved. A tennis player, for example, might need a different size racket. A golfer might need to tweak her swing, maybe stop holding the club so tightly. And finally, bracing. A thumb spica brace or splint is very good at helping the tendons to rest. The nice thing about a thumb spica brace is that it immobilizes the thumb and the tendon and lets them rest. The hard part of a thumb spica brace is that, as humans, we tend to like to use our thumbs quite a bit. And so for the same reason that the brace is effective by limiting the thumb's movement, it can also be very annoying. Still, a brace can be a very effective option to use, especially in the short term. When you move away the sticks, sometimes that fire, sometimes it dies down on its own, often it does, but sometimes it's just stubborn and it just keeps on burning. When the fire keeps on burning, you can take a fire hose and put water on the fire. And there are 4 good fire hoses that we can use for de Quervain's tenosynovitis. Ice is actually a very good anti-inflammatory modality for de Quervain's because the inflammation is so close to the surface of the skin. If you have back pain, for example, and you use ice, the cold's not going to penetrate to the level of the spine. It's just too deep. There's too much soft tissue, even in someone who's skinny. But the thumb tendons are so close to the surface that the cold from the ice will absolutely penetrate to the tendon and reduce the inflammation there. If you're icing the tendon, remember to protect your skin by wrapping the ice in a thin cloth or use a bag of frozen peas and try to ice it for about 10 to 20 minutes at a time. You can do that several times throughout the day. Similarly, another good anti-inflammatory source or fire hose is topical diclofenac. The most common topical diclofenac that's over the counter is called Voltaren gel. This is basically like using a topical Advil or topical Aleve. Topical diclofenac is an NSAID that goes through the skin and to the site of inflammation. Like with ice, the topical medication won't penetrate to deep structures like the spine or the hip or the shoulder. However, topical diclofenac will penetrate to the level of the tendons in the thumb. So this can be a very effective fire hose for something like de Quervain's tenosynovitis. Obviously, if you have a contraindication or an allergy to NSAIDs, then this isn't going to be a good option for you. A third fire hose option that's more invasive and also more effective is that under ultrasound guidance, a doctor can inject medicine directly around the tendon to calm the inflammation. One option for this injection is injectable Toradol, which is like injecting a liquid Advil. The advantage of using Toradol in an injection around the tendon is that Toradol is not bad for the tendon, and it can be quite effective at reducing the inflammation. And with that said, the gold standard medication to inject for de Quervain's tenosynovitis is a steroid or cortisone injection. A side note is that no one actually injects cortisone, but what we do inject are cortisone derivatives. Okay. The advantage of injecting steroid is that it's probably the best anti-inflammatory medication that we have to take away the inflammation. The main disadvantage of injecting steroids for de Quervain's is that steroids simply aren't good for tendons, and over time, steroids can weaken tendons, so you want to limit the number of times that steroids are injected around tendons. Now, with that said, in an otherwise healthy tendon, one injection for most people should be fine. Obviously, talk to your doctor about that. No matter what is injected, in the case of an injection, you want to make sure that it's done under ultrasound guidance to ensure proper placement of the medication. You don't want to be actually in the tendon, but rather you want to be next to it. And you can't do this optimally and safely if you can't see what you're doing, and you need an ultrasound to be able to see what you're doing. The limitation of an injection is that over time, the medicine will inevitably wear off. It's just like a fire hose. The water puts out the fire, but then the fire hose inevitably turns off. And that doesn't mean that when the medication wears off, that the inflammation will necessarily return, but it certainly might. So a lot of that depends on if you're going back to the same offending activity as caused the problem in the first place. Ideally, even if you use an injection, particularly if you're going to go back to the same types of difficult activities that led to the problem in the first place, you want to also make sure that you're working on stretching and strengthening the muscles in the thumb so that as the medication wears off, the fire doesn't return in spite of returning to the activity. There are other options for difficult cases of de Quervain's. The most popular alternative option would be regenerative medicine. Regenerative medicine techniques essentially involves injecting something that prompts the body to go and repair itself. The most popular regenerative technique for de Quervain's tenosynovitis would probably be platelet-rich plasma, or PRP. PRP is a procedure where you aspirate the patient's blood, you use a centrifuge to spin down the platelets and the growth factors, and then you inject those platelets and growth factors back into the pathologic site with the idea that the growth factors and the platelets will attract the body's own healing mechanisms. Other similar techniques include injectable prolotherapy, amniotic fluid, bone marrow aspirate, and there are some other approaches that also try to get the body basically to go and try and heal itself. A major drawback for all of these approaches is that insurance almost never covers any of them. And this is because while evidence for them is certainly growing, it still remains pretty sparse. So personally, for tendon problems, if PRP were a covered procedure, I would often recommend using PRP before using steroids. However, regenerative medicine techniques can be very expensive, typically costing between about $750 and $3,000 or more, depending on the particular doctor and the particular regenerative technique that's being considered. And the reality is that most cases of de Quervain's tenosynovitis will get better with good, basic, evidence-based conservative care that we've already discussed without the need for regenerative medicine. And still, regenerative medicine is certainly a reasonable option. For me, something like PRP is particularly reasonable if exercise and bracing alone aren't fixing the problem, and if money's not a limiting factor. It's also very reasonable if a full complement of conservative care, including a steroid injection, hasn't helped, and surgery is then being considered, but the patient wants to avoid surgery. So in that instance as well, even with the expense, if it's possible, PRP might be an excellent option. Now, although I've not personally yet encountered it, there are certainly times and certainly cases where conservative care won't fix de Quervain's tenosynovitis. When this is the case, there's a small surgical procedure with a very good track record of success for de Quervain's tenosynovitis. The surgery is about 30 minutes. It's a procedure done under local anesthetic in which the surgeon makes a small incision and cuts open the fibrous roof of the tunnel that the inflamed tendons are running through. By cutting this roof off, it decompresses the tunnel and allows the tendons to glide more freely through the tunnel. Okay. As always, if you have any questions or comments, or if you have any requests for future videos, please leave us a comment in the comment section. And please remember to hit the like button as it helps us with our YouTube algorithm. We really appreciate all of your support. If you haven't already subscribed to our channel, please consider doing so now. Thank you very much.